At the Grand Hotel in Folkestone this morning, health bosses and Kent residents discussed options on how to improve East Kent's hospitals, which are some of the worst in the country. Two main options have been put on the table. The first would see a reshuffle at QEQM, William Harvey and Kent and Canterbury, including A&E services. The other would be a super hospital in Canterbury, funded by Quinn Estates in exchange for 2,000 homes to be built.
National benchmarks that at the moment East Kent is missing, particularly around A&E care, around cancer care, they're really serious and we really want to look at that. The reason why the hospital has had to move some services out of Canterbury on a temporary basis has been because we haven't got the workforce in East Kent. So what we're doing now is trying to look to develop a system which is sustainable into the future, delivers the care for patients and the quality of the care.
Expanding and using existing parts of K&C Hospital, along with the developer's money, could halve the cost of an outright new hospital in Canterbury, which campaigners say is an ideal location for East Kent.
The thing is that there are going to be some roads onto the A2 and onto the major roads. It's not going to be stuck in the middle of Canterbury. I feel for people there, but of course what they've got to remember is where they're going to go. We're not taking anything away from Ashford. I'm sure services will still be at Ashford and they'll still be at Margate. It is about this hub making a centre of excellence in the middle so that everybody from everybody around gets the best possible service they can.
While the temperatures outside in Kent plummeted today, inside the Grand Hotel in Folkestone where the meeting was held, the audience's temperatures were rising as those who lived on Kent's coastal and rural towns said that any hospital built in Canterbury could have serious impacts on their healthcare.
Well, my worry is that if Canterbury and this new hospital goes ahead, what you'll have there is you'll have further time constraints put on the healthcare of people in some of the most rural and deprived areas at the same time. We've also got at the moment with the Kent, the KCC and their cuts to the bus services with the loss of some hospital buses. This is just going to have further disastrous consequences for local people.
No decision will be made until public consultations next year, meaning that in the meantime, you can have your chance to say how you feel about the plans, which have already had mixed reviews. Harry Pete for KNTV in Folkestone.